You know your baby. You have been feeling them move for weeks or months. If something feels different, it's probably different. If you're watching this video right now and you are genuinely worried that your baby has stopped moving, stop this video right now, put down your phone, and go to the nearest maternity unit. Don't wait, don't Google, don't watch the rest of this video. Just call your midwife or go to the hospital right now. You're never wasting anyone's time. Just go. We'll be here when you get back. If you're here because you want to understand fetal movement, what's normal, what to look out for, and what the evidence says, then stay with me. This video is for you. Hello and welcome back to The Midwife Says. My name is Melanie and I am almost a licensed midwife in the state of Florida. I talk about everything women's health, pregnancy, birth, and postpartum, and I make these evidence-based videos every Tuesday, Thursday, and Sunday, so subscribe so you don't miss a single one. So let's start with what normal looks like. Most women begin feeling fetal movements between 16 and 24 weeks of pregnancy. If you have a placenta that's in the front, you may feel movements even later. If this is your first pregnancy, you may not feel them until closer to 24 weeks, and that's completely normal. If you've been pregnant before, you may notice them earlier. Movements can feel like kicks, rolls, flutters, swooshes, or hiccups. There's no one way they feel, and no two babies move the same way. Here's the most important thing I want you to take away from this video. There is no universal number of movements per day that count as normal. What matters is your baby's pattern. Every baby has one. By around 28 weeks, you should have a sense of when your baby tends to be most active, perhaps after meals, in the evenings, or when you lie down. What you're watching for is a change from that pattern, a reduction, a quietness that feels different to you. That instinct, that sense that something is different matters. Trust it. I also want to say that it's very normal when you get towards the end of pregnancy for the movements to change a little bit. So rather than big punchy movements as they were when the baby had a lot of space, they'll become more rolls and stretches and things like that. That's normal, as long as you're still feeling the consistent movement at that consistent time of day. Now, I want to talk about something that often confuses people because I think you deserve the full picture. You may have been told to do formal kit counting, timing how long it takes to feel 10 movements, or counting movements over a set period each day. This is widely recommended and comes from a good place. The idea that a reduction in movement can be an early sign that a baby is under stress, and catching it early could prevent stillbirth. Movements are the number one sign of your baby's well-being, always. Here's what the research actually says about formal kit counting. A Cochrane systematic review, one of the most rigorous types of evidence reviews we have, analyzed 5 randomized controlled trials involving over 71,000 women. The conclusion was that there is currently insufficient evidence that formal structured kit counting reduces stillbirth rates or other complications compared to general awareness of movements. Also, a 2023 meta-analysis reached similar conclusions, that while awareness of movement and appropriate follow-up is associated with better outcomes, no specific counting method has been proven superior. So what exactly does this mean? It does not mean that movement doesn't matter. It absolutely does. Reduced fetal movement is associated with fetal growth restriction and stillbirth. The uncertainty in the evidence is specifically about whether counting a fixed number on a fixed schedule adds more benefit than simply knowing your baby's pattern and acting immediately when something changes. So if your care provider has given you a specific counting method to follow it. If not, the most evidence-aligned advice is this: you know your baby and report any change that concerns you without delay, even if you perform fetal kit counting and your baby has all the movements they should. If you feel worried, go in. If you feel your baby is moving less than usual ever in this pregnancy, trust that feeling. And again, if you're feeling that now, you should be in the hospital. But this is more for the future. So if this ever happens, this is what I want you to do. You know your baby. You have been feeling them move for weeks or months. If something feels different, it's probably different. Do not talk yourself out of it. Don't wait until tomorrow. Don't eat something sweet and lay down. Don't use a home Doppler. Please don't use a home Doppler to check the heartbeat and reassure yourself. And I need you to hear this clearly. Hearing a heartbeat does not tell you your baby is well. A baby can have a heartbeat and still be in serious distress. A Doppler at home cannot assess your baby's well-being. Only a proper assessment at a maternity unit can do that. So contact your provider or just go directly in for your maternity assessment. Not the next morning, not that day. Go immediately. There's always someone there for you. You are not going to be wasting anyone's time. You will never be wasting anyone's time. The staff would far rather see you and reassure you than having you sit at home and be worried. This is your baby's health and your mental health. Please go in. Okay, so what happens when you do go in to get assessed? When you arrive, your provider is going to check you in if you're going into the hospital. If you're going into the emergency room, they're going to have you fill out some paperwork and they're going to bring you up to labor and delivery. And they're going to start monitoring your baby's heart rate using something called a CTG, a cardiotocography. This records a heartbeat over a period of time and looks for normal patterns of variation. It's non-invasive, it's painless, and it's safe for you and your baby. Depending on your week's gestation and findings, they may also perform an ultrasound to assess growth, amniotic fluid, and observe movement directly. This is called a BPP, biophysical profile. These tests carry no risk to you or your baby. They are straightforward and they exist precisely for moments like this. To summarize everything in this video, there is no magic number of movements. You know your baby's pattern, trust your instincts. If something feels different, act on it immediately, that day, without waiting. The research on formal kit counting has limitations, but no study has ever suggested that waiting when you're concerned is safe. The message from every guideline is the same. Report reduced movement promptly. That's it. It's that simple. You are your baby's first line of care. Take that really seriously. Thank you so much for spending your time with me today. I truly enjoy making every single one of these videos with you. And if you found this content valuable, please make sure to like the video. That lets YouTube know that it's good content and we'll share it with other people who need it. Take care of yourselves, and I'll see you next time.